All right, you guys, time for your health check. While students and teachers enjoy those last few weeks of summer break, preparing for back to school is obviously not business as usual this year. School supplies are going to include things like face masks, hand sanitizer, gloves, and possibly protective eye gear. So joining me live from New York, it's a neuro-ophthalmologist, Dr. Rudrani Banik, to talk about the dangers of blue light emitted from digital devices, because this has doubled in 2020 because of all this social distancing and working from home, schooling from home. So thank you so much for joining us. Can you explain what is blue light, first of all, and what happens when it actually penetrates our eyes?
Sure. Well, first of all, thank you for having me. So blue light is everywhere. There are natural sources of blue light. For example, we get blue light from the sun, but we also get artificial sources of blue light from all of our devices, whether that be a phone, a computer, a tablet, our television, and even some of the lights that we have in our homes. For example, CFL lights, which are energy saving, but they emit blue light, and LED lights emit blue light as well. So in terms of what the health issues may be with blue light, there is a concern for sleep issues. It can make it more difficult to fall asleep and stay asleep. But in terms of our eyes, it has been associated with a syndrome called digital eye strain. And that's really been the biggest concern, I think, with blue light.
Yeah, and it's a good point. This is a year-round thing. It's not just when kids are trying to do schoolwork. So I get this question a lot, Dr. Banik. Do those blue light blocking glasses work?
Yeah, so I get that question as well. So there is no proof yet that they really are effective. And also, there are many manufacturers out there, and each one has their own filter. For example, some may be more blue blocking than others. So just be cautious if you're thinking about getting blue blockers. They may help with sensitivity to light, but there is no proof that they really help with digital eye strain. It just has not been studied yet.
So with that said, what are some other ways that we can naturally filter out blue light?
Yeah, so many people don't realize that we actually have natural blue blockers inside our eyes. So nature has provided us with 3 pigments in our retinas, and these pigments have fancy names. They're called lutein, zeaxanthin, and mesozeaxanthin, and they're pigments that help absorb blue light and UV light as well, and they protect our eyes from these wavelengths. And we can get these pigments, we can't make them by our bodies, but we can get them from foods. For example, green leafy vegetables, orange and yellow vegetables like corn, orange peppers, even some spices like paprika. But unfortunately, most of us just don't get enough of these pigments from our diet, and that's why supplementation is so important. And the best way to get all 3 pigments in your eyes, I've actually done a lot of research on this, is to use a supplement that has an ingredient called Lutamax 2020, and that Lutamax 2020 will provide you with all 3 compounds, all 3 nutrients, lutein, zeaxanthin, and mesozeaxanthin, to protect your vision. And it's great because they also have gummy forms. So there's actually a gummy form that we use in our house that my daughter loves, and she pops these like candy. And for kids, it's hard enough to get them to eat some of those fruits and vegetables, but it's easier for them sometimes to take a gummy supplement.
And Dr. Banik, we only have like 10 seconds, but I want to ask you, you specialize in migraines and these neurological conditions. Are you seeing patients coming in with more episodic migraines and things like that because we're in front of screens all the time?
Yes, so definitely I think the incidence of migraine has risen during the pandemic, partially because of screen time, but I also think because of the stress that many of us are under. Stress is also a big trigger for migraine, so it's just something else to consider.
Thank you so much for your time. That was really helpful. We really appreciate it.
Thank you so much.
All right.